So I'm going to do the wet to dry dressing change skill. So the first thing I would do is provide for privacy, do hand hygiene, and then I'm going to address the patient by 2 identifiers. Hi, my name is Alex, and I'm going to be your student nurse today. And your name is Annie Gray, and your date of birth is 5/19/96, and she confirms, so we can continue with the care. And the doctor has ordered us to do a dressing change. The dressing was actually checked yesterday, but we would do this once a week. And we've already medicated Annie with pain medication before, or 30 minutes before this procedure. So she's ready to have her dressing changed. So I'm going to put the bed up to a working height. I'm going to pull back your dressings, Annie, or your covers, Annie. And we're going to change that wound dressing on your abdomen today. And since this is sort of near her peri area, I have another towel I can just use to cover her with, so if we don't expose her too much. I'm just going to put that back and just drape this over you, Annie. Okay. And then I'm going to fold down a biohazard bag, place that at the end of the bed to put the dirty dressings in. Then I'm going to put on clean gloves to take the dressing off. And I did hand hygiene before this. I'm just going to put these clean gloves on. We're just going to gently take off the tape, making sure not to tear her skin. Okay. Fold this down. We'll take this off. And then I'm going to just assess the wound, and I notice there's no drainage, so we can continue with our wound care. I'm going to take off my clean gloves, dispose of them, and then we're going to do hand hygiene, and then I will put on my sterile gloves to do the cleaning of the wound. And before that, I need to establish a sterile field, so this is my clean countertop. And I'm actually going to get my tape ready before I'm all gloved up, because it's easier to rip right now. And if the tape was contaminated, we would do hand hygiene again before putting the sterile gloves on. So I'm going to establish my sterile field by taking my sterile gloves, and we're just going to pretend for the purpose of this that these are all separately wrapped in sterile containers. This is nice in front of me. Okay, we'll get our sterile gloves out. Use my gloved hand to grab the cuff of the other glove and put it on. Okay. And then we're going to take out a couple dry dressings to place over the top of the wound. And then I'm going to use my saline, make sure it's not expired, and it is not, so we can continue, and we're going to put our palm to the label. Take the cap off, place it up, and pour onto the dressing so we can clean the wound. Put that back on. Okay. And then we're just just going to clean from area of least contamination to most contamination. So we'll start the middle first. Put that in the biohazard bag. We'll grab another piece for the side. Biohazard bag. And we'll use another piece for the other side. We use a clean piece of gauze, or a new piece of gauze for each part. Okay. And so this is wet to dry, so since I got my saline here, we're going to actually pack this wound with the saline covered dressing. So I'm going to coil it around my finger to get it out. And we're going to pack that into Annie's wound. Scrunch it up, squeeze it out. Okay. And I'm not going to touch the outside part of her skin because that is contaminated. So we're just going to pack this in here. Okay. And then we'll use a dry dressing to go over the top of the wound. I can actually use two of them because this is a quite large wound. And then I'm going to take my sterile pad that I had opened up from a sterile package. We'll place it over the top, and then I already have my tape out, so I can just tape that sterile gauze. I actually would have put it on this way. I had it laying down on the wrong side. So the blue line would face up. We're going to tape down that gauze, or the pad. And now that her pad is secured, I can take my gloves off and put those in the biohazard container. We can take this off. We'll cover Annie back up, and we're going to ask about any sort of pain she's having. We can assess for her pain. And since she's still feeling okay because we medicated her 30 minutes before the procedure, we'll put her bed back down, make sure her call light is in reach, dispose of the biohazard in the biohazard container, clean up our working space, and then we'll be complete with the skill.